Welcome to our first virtual Lunch and Learn with here at the Candy Factory. We have one of our full-time members, Josh Brooker. He is with PA Health Advocates, and I personally have worked with Josh. He's really great to work with, and I'm excited for you to get to see today's presentation. And this is our first time doing it this way, so we are in a testing phase, so bear with us. Thanks for joining us. Take it away, Josh.
Hello. So today's discussion is a lot more informal than it's meant to be formal. But ultimately, I think the plan today is to talk for about 30 minutes, talk about health insurance, which everyone loves, we're all excited about, and ultimately to hopefully dispel some misnomers, come up with a few solutions that can really help anyone, and make it a little less painful. I think that's my hope, anyways. So we are here at the Candy Factory. I am a full-time member. I always like to show appreciation for the organizations that I work with, and ultimately, as a co-working space, comparatively, I've worked in many of offices over the last several years where the person down the hall never wants anything to do with you, and I'm really appreciative of more of that family relationship where everyone's kind of working together, and not daily, but ultimately there's more camaraderie that I see here than I do in a lot of spaces. As far as myself, I always like to give a little bit of background as to who I am. I have been a financial planner since 2011. I joined the industry as an estate planning specialist, which another fun topic to talk about, death. But ultimately, it was with the understanding that I have a background in mechanical engineering. I love numbers, problem solving, and I try to make very complicated concepts simple. A few years into me being in that role, my oldest was born. So I have two kids, one's 7, one's 5. The 7-year-old was born at Women's and Babies on New Year's Day in 2013. And ultimately, about 3 months after, there was arguments between the two insurance companies. They basically said his mom was admitted in 2012, he was born in 2013, you need to pay double deductibles, double co-pays for the medical claims. So being in the industry, thinking that I knew how health insurers worked, we all know that they try to get out of paying any claims they can, but ultimately I didn't really have an advocate that day. We had great nurse practitioners, we had a great hospital staff that made sure that he was born and he was healthy, and his pediatrician found that he had a heart defect when he was born, all within 24 hours. So everyone was doing their job, but no one's job, it was really no one's job to be there and financially advocate for us. Had they said, go home, be miserable at home because you're miserable here, and wait a day, your costs would be cut in half. We would have welcomed that information and done what we were told. So our organization is really designed to help people navigate not only getting insurance set up, but also supporting them through claims and billing support. Some drastic situations that we've had. We had a client a few years ago, business owner, who ultimately has employees in New Jersey, Pennsylvania, New Mexico, North Carolina, and I think I said Pennsylvania, but Pennsylvania. And they do about $3 million in revenue a year. He, even though I've told him to stop, is on his 8th child. His last child was born in the NICU in November and was not released from the hospital until February. And ultimately, through that time, it wasn't like our situation, but it was definitely something where the hospital makes agreements with the insurance companies and decided effective January 1 of that year, the hospital was no longer going to work with the insurance company. So my client got about $750,000 in medical debt because he didn't have a resource or had no way of knowing that health insurance was going to be that much of a thorn. He had insurance. He had a reasonable deductible. But who knows that these situations are going to happen where the hospital stops working and no one's going to move their child in the NICU to a different hospital mid, them having a problem because they need to be in the NICU. So in that case, that's an extreme situation where we had power of attorney paperwork signed and we actually advocated for them on the claims side. We got the surgeon involved. We actually found a letter online from the CEO saying if you're going to enroll in health insurance, you should be enrolling in this insurer. That was predated to their agreement ending, but ultimately after we enrolled in coverage for the client. So we were able to get that $750,000 bill brought back down to the deductible that he would have ordinarily had to deal with. So a lot of moving parts there. In addition to that, not only are we doing individual health insurance, we do Medicare, we do group health. All of that is outlined on our website. We're also a broker of brokers. So basically, when people in the industry need to turn to somebody, they turn to us as a resource. We work with Ross Insurance over on Lidditz Pike as their dedicated Medicare specialist. So even a broker that may dabble in certain industries that don't necessarily want to dive in, we'll help them out and create strategic partnerships to be able to make sure that their clients are getting the adequate resources that they need. So really today was meant to be more forum-based. I think if there are specific questions, I'm hoping to answer those, but ultimately what we're dealing with right now is there are about 400,000 people in Pennsylvania that are about to be thrown for a loop because in the past they've enrolled through healthcare.gov, and those individuals are largely people that have retired pre-65 that are trying to figure out health insurance, solopreneurs, you're self-employed, you don't get coverage through an employer, or small groups, 50 employees or less, where you're trying to figure out your own insurance program. And Pennsylvania is going from a federal healthcare.gov to a state-based exchange called Pennie. Pennie is live. You can go to pennie.com right now. It's Pennie, so Pennsylvania Insurance Exchange.com. It is live for beta testing, so people like me are trying it out and working to make sure it's going to be ready for open enrollment. You can't enroll there yet. You're still having to go through healthcare.gov or through an independent broker. But it's definitely something that is going to impact a lot of people. Lancaster County specifically, we have about 12,000 people that enrolled in healthcare.gov over the last several years. Each year they're trying to deal with the system, and ultimately you're going to have to create a new login, username, password, and kind of re-answer a lot of those questions. We also have a unique market. In Lancaster, we're fortunate. We have options. We have UPMC, we have WellSpan, we have LGH, we have Hershey. We have options as far as providers are concerned. We also have options as far as coverage is concerned. So again, we have UPMC out of Pittsburgh for insurance. We have Highmark, Capital Blue, Geisinger, all the big names that are out there are available in this area. The problem is that they don't all get along because of roots that are a lot deeper than they'd like to admit. Specifically UPMC, Hershey, and Highmark. So if you're looking for coverage this year, I always tell people to be a lot more cognizant of the differences between those two. Hershey and UPMC have very heavy roots in Pittsburgh. And because of that, they tend not to want to cross paths or not come to agreements when it comes to claims. And the same comes through, we've gotten better over the years with Capital Blue and WellSpan, as WellSpan has taken over ICHRA Hospital and kind of moved in there. But ultimately, we've seen in the past where carriers will just class out a specific hospital system. And just because a plan is the cheapest out there doesn't necessarily mean it's the right one. So last year, we had a ton of people flocking to Highmark because they became the cheapest carrier. But ultimately, they don't work with UPMC. They don't like them. Just as par for the course, because in Pittsburgh, they've had such a clash agreeing on what a medical bill should be. So ultimately in this area, if you're enrolling in a Highmark plan, you're going to see that Highmark is the cheapest under their My Direct Blue plans. That's their version where ultimately they say we're going to work with LGH and we're going to work with Hershey, but we're not going to go anywhere else. The moment we start adding in UPMC and WellSpan, the prices are right up there with Capital Blue Cross and with QSEHRA, because ultimately they're trying to say if you don't have to deal with our nemesis, so to speak, we'll give you a discount, because we've negotiated rates with LGH and Hershey. So those are kind of the big things that we've been dealing with. Yesterday we were on a call with Department of Human Services, CMS out of DC. We didn't get a whole lot of changes that are happening. It seems that as an industry, we're moving towards telemed faster than we ever thought. Because and I've been saying this for years, who wants to sit in an ER or an urgent care facility to get antibiotics? Who wants to take the time to drive there, drive back, sit in a waiting room just to get what you know to some degree that you need? It's only gotten more prevalent now because of COVID, that if I can avoid being around other people, I'd like to do that. But it's going to be very interesting this coming open enrollment. We have people that are worried that the costs are going to be higher for health insurance because ultimately we're having to deal with more claims due to COVID. The sad truth is, and at least in the short run, rates are going down. So the rates have come in from the carriers. They're about 10 to 15% cheaper. So part of that is because Pennie, Pennsylvania taking control of the exchange, means that any savings that they can have, they can put right back into the system. And what they decided to do is, since they're saving so much money by handling it locally, they're able to set up a high risk pool for reinsurance. So in layman's terms, no one likes to pay a claim more than $100,000. As a consumer, we don't want to do that. So to expect an insurance company to do that, it's basically what they do behind the scenes is that most of your insurance companies will actually have their own insurance for those high claims. And the government is basically saying, at least at PA's level, that they will cover a portion of those claims in this pool. So it allows you to cut costs. The other thing that you'll see is that COVID, at least in the short run, has lowered other costs. People that would have ordinarily done an elective surgery for their knees or for their hips or for whatever have decided, I don't know that I want to be in an environment where they're trying to deal with other things. I say temporarily because we all know that eventually those hips are going to need to be replaced. But the rates are locked in for the year. So right now, the insurance companies are fighting back and forth with the state to say, here's the reduction that we want to see. Once the states approve those reductions, they are locked in for all of 2021. So even as claims go up and the actuaries are looking at the rates, they're still going to be there and at least affordable this coming open enrollment. So we're excited about that. That helps the small group market just as much as it does the individual because those rates are consistent. When ACA was originally designed in the small group market, there was SHOP as a program to help small businesses. SHOP has gone away. The government won't admit that. I am SHOP certified, even though there are no SHOP plans in Pennsylvania at all. I don't know why I am, but I am. But even though that program isn't there, small businesses that need group benefits, that truly go through a group benefits process, are going to see those rate reductions as well. So should be interesting. I still have 15 minutes. So I don't know if there are specific questions, specific things you guys are looking for. I will tell you that some of the tricks that we have seen, at least in the small kind of solopreneur individual market, is it's really a design of figuring out income and figuring out what you qualify for as far as tax credits. So Dave will be the first one to say that the bane of some preparers' existence is miscalculating your income, because all too often, at least in this space, you get a lot of information from a lot of different people, and they tend to pick what they want to talk to you about. So what I mean by that is if you talk to healthcare.gov, or you talk to, if you go to Lancaster General Health and you talk to one of their sisters, they're only going to talk to you about what's available on Pennie or on healthcare.gov. They're not certified to do anything. They're not preparers. They can't talk to you about income. They can't talk to you about taxes. They will just talk to you about, effectively, they're order takers. You put inputs in, they spit out rates. The problem is that a lot of people that try to get away from that and go with brokers are at the whim of whatever broker they're talking to, because ultimately the broker that they're working with can be captive or independent, and depending on where they fit, you could run into a lot of issues. And it may not even be the person that you're talking to. It may be you have a really good friend that is a CPA, and you go to that friend and you say, I need health insurance, who do I talk to? And they happen to be in a networking group with one of these captive brokers that they have a partnership with, and you wind up in the hands of a broker, not on purpose, just because that's the way it works. The reality is that the person you're talking to should have expertise in financial systems, should have expertise in health and insurance law, but they should also have an open architecture where they're going to meet you where you need to be. So as far as our organization is concerned, we look at on-exchange, off-exchange. We talk about faith-based plans, what the difference between Medicare versus Christian health ministries is. We talk about short-term medical and where that's a good fit for certain people. But all too often, what we see for the people that miscalculate their income is that ultimately it's usually a friend of a friend that will do a one-off service to try and help somebody, but they wind up hurting them. Because you're trying, at least in the individual market, you're trying to see if you qualify for tax credits a year ahead of knowing whether you qualify for tax credits. And no matter how many times I yell at CMS and I try and say we need to change this system, they don't hear it. Because it's intertwined between the IRS, Department of Labor, CMS, which is Department of Human Services, and they all have to come to the table to make this work, and they're not. So ultimately, when you're buying health insurance, you need to say, okay, I need coverage for 2021. What do I think my income is going to be December 31st, 2021? How do you do that as a business owner? I don't know. Hopefully I get it right, especially because if you look at a realtor, they may have 10 houses sold this year, 50 houses sold this year. We hope for the 50. I'm trying to think, I have a metal worker that the price of steel changes and all of a sudden their deductions change. We have COVID. How much is our mileage deduction going to be this year if we can't actually travel and we do everything online? It's really a balance of what is my income and what is my expense, and ultimately that is a moving target. So part of our struggle is ultimately the goal of our clients is to offload that responsibility to us. And then what we usually do is we try to talk to all of our clients in April, shortly after tax season, which was July this year, and then usually in the fall, because if you're having a run on income, you should be proactively trying to manage it. The problem is that let's say you pick a plan based upon income projections, you're enrolled in that plan, you don't find out until September that you don't qualify for what you thought you qualified for. The IRS only cares about December 31st of that year. So any tax credit you would have gotten for those 9 months, you have to pay back. So it's very critical that if you're figuring out income and that's a moving target, it's less about, at least as a business owner, it's less about, oh my gosh, I'm gonna have to pay that $9,000 back, and more about, okay, this is the boat that I'm in. I should be talking to a tax professional on strategies to lower my income, either by purchasing assets and depreciating properly, or investing back into the business to hopefully offset that. Those are good problems to have, because ultimately if your income exceeds what you projected, that means you have a surplus of cash flow, right? So those are conversations to have. But the issue is that so many brokers that do these one-off services, they enroll you, you don't find out until 18 months later you did it wrong. And by then, that broker is typically not doing health insurance anymore because they saw how frustrating it was the first couple that they try to help people with. So I always try to say the conviction for us is my 7-year-old, right? It's an understanding that this whole system is broken, and no matter how perfectly you do it, there's going to be an issue. You should have someone kind of beside you to navigate those issues, because they're going to happen. That life happens, and there's so many moving targets in here that it really makes sense to have someone to help you through it. So, yes, ma'am.
How best do you recommend that we get in contact with you? Share first.
Yeah, so because of the amount of, so I don't know if you guys heard that, but how best to get in touch with us. Because of the fact that I still have an active role as a financial planner, and because of the fact that we do so many different things, my time is very limited. And Krisha will be the first one to tell you that I don't even know what's on my calendar right now. I always say, ask Erica. Erica is my assistant. She is the one that handles all of my scheduling. So it's either speaking to Erica, or if you send me a message on Slack or anywhere else, I can always forward that along to her right away. If you send me an email, that she's monitoring my email all the time, so we don't miss stuff from Ross or any of the other partners that we have. But I'm basically back-to-back meetings. I usually say if there's a conversation you want to have that's a little bit more lengthy, like figuring out income, figuring out a lot of this stuff, you want to do it outside of open enrollment, because during open enrollment, I tend to have about 300 meetings. So you know what that pain is like with tax season. I have a month and a half. There is false hope this open enrollment. So with Pennie, we also have an extended open enrollment in Pennsylvania that is going to be, instead of November 1st to December 15th, it'll be November 1st to January 15th, which gives us false hope that we have an extra month to actually figure this out. But if you don't figure it out by December 15th, you have no insurance for the month of January, because any enrollments between December 16th and January 15th are going to be with a 2/1 effective date. So if anything, for us, it's just going to be those stragglers that couldn't decide what they wanted to do, that we have to kind of be reactive at that point. And sadly, what we're probably going to wind up doing is enrolling them in a short-term plan for the month of January, and then a fully covered major medical plan for the month of February moving forward. So, but yeah, I would say that the short answer is Erica is the lifeline to getting something scheduled, which is Erica at pahealthadvocates.com. It's Erica with a K, E-R-I-K-A. Or going directly to our website, which I put in Slack earlier today, gives you a good baseline as to the different ways that we help our clients. but it also has a blue bar on the left-hand side that says completed intake. Because of the amount of volume that we see during those times of the year, the peak times that we have, we very much operate like a doctor's office. We have clients fill out information ahead of time. That gives us the data that we need, and then typically we'll have a 20-minute phone call, which is broken up into two parts. One is understanding your income, really diving in some cases we ask for tax returns, so that way we can figure out if there are anomalies. Because for most people, especially in business, you hand everything to the accountant and you hope never to see it again. So we'll kind of piece through and see what we're seeing as your modified adjusted gross income. And then ultimately, the other half is really understanding how you use your insurance. Because two plans, two exact premiums, they may look the same on paper, but if you take specific medication that one considers a preferred generic drug and the other one is a non-preferred brand name drug, depending on how they look at things, it could be $100 difference per month based upon that. So we look at drug formularies, we'll dive into your physicians to make sure that they're in network. This past year, we had a problem where UPMC actually said that they work with WellSpan when they don't, because in the fall of 2019, WellSpan had a doctor that retired that was not a WellSpan doctor when he started his practice several years ago, and he did work with UPMC when he got acquired by WellSpan, when he sold his practice to WellSpan. He kept working with UPMC, but then he retired and UPMC didn't tell anyone that he was actually a WellSpan doctor that they don't accept. So we will actually dive in and double and triple check your providers to make sure that they're in network. So, and we work, I should clarify as well, we are not just local to Lancaster. We have clients, I believe, in 11 different states, and we take that same due diligence when we add a state. Usually we ask for a little bit of lead time, so we brought on a dental practice in Florida, and we actually dove into how the providers respond to the different insurance companies to make sure that a new insurance company that moved into the area over the last year was touting great rates, but they worked with none of the providers. So it was basically saying, okay, you can drive from Tampa to Orlando if you want to use them, but I wouldn't recommend them. I would recommend this carrier over here. That's going to be a little bit more, but your employees are going to have decent coverage. So, any other?
So what should, as someone who's self-employed, what
Yep.
should you be looking for when it comes to an ideal plan? Like you're saying, in network with your physician.
Yep.
And it also when it comes to pricing, because obviously that's been a big challenge for
Yep.
entrepreneurs, is the fact that there's just not, the cost just is so high.
Right.
The deductibles are so high.
Right.
Besides the tax credits, which some of us don't
Qualify for.
for,
Yeah.
what would you say is probably a good, like, in the middle plan that isn't as expensive if you don't have some crazy deductible that,
Is unattainable.
right?
Yeah. So so to answer your question, you're basically asking, as a self-employed individual, what am I looking for as far as a quality plan? First thing is, that's probably my car. So the first thing that we're trying to identify is where you are on the income spectrum. So let's say you're self-employed and you're new to business. You've never done this before. You're getting out there, you're getting your feet wet. You have a couple of contracts that are coming in. You're really happy about it. The reality is that just because this is terrible, right? Where are my keys? So if you're brand new to business, the IRS says that in the first 5 years, you have to have 3 years. You can have 3 years of showing no profit before you become a hobby instead of a business. So under that premise, if you're showing no taxable income, you're actually eligible for Medicaid, which in Pennsylvania is income only. All they care about is income. So if you've got income coming in the form of cash flow for your business, but you're investing it all back in, you're paying taxes, you're writing off everything, and you're showing a negative income, you're actually eligible for Medicaid, which is zero premium, zero deductible, zero coinsurance. So that would be the first conversation, is if you can get some of those Medicaid programs. They're really designed, I think Medicaid gets a bad stigma because there are certain people that try to be lifers in that system, right, and stay on Medicaid for as long as possible. But if you're a startup and you have no income, that's what it's designed for, is to help people that are trying to get from point A to point B. If you are, still in that growth phase, but you're starting to show positive revenue and you're ultimately qualifying for the tax credits, we will still try to say that that's probably your best route. It's when your income gets beyond that threshold. So if you're single, it's $48,000. If you're married, it's $64,000, $65,000. If you have one child and you're married, it's $80,000. Two children, it's about $100,000. So as your household grows, and obviously as your income grows, eventually you may hit that threshold. You may be beyond that. In the event that you have children, we always recommend CHIP. CHIP in Pennsylvania, again, is income only. You can qualify for CHIP for your kids as long as you make between $0 and infinity. It's just a matter of how much it costs. It is a sliding scale. So the more income that you have, the more you're going to pay for it. But in this area, United Healthcare is probably the carrier that we work with the most for full cost. It's $144.50. So if you have one child, if you ordinarily go through the Affordable Care Act, you try and buy a plan on healthcare.gov and you try to insure that child, it's going to be about $300 to $350 at full cost. CHIP at $150 is going to be a better route for you. And then usually the businesses that we talk to, it then becomes a conversation of health history. So if I have a lot of health problems, we're still going to say the Affordable Care Act plans are going to be a better route. But in the event that you're pretty healthy and you see health insurance as a hedge, I don't want to lose my business, I don't want to lose my family, I don't want to lose this or that or the other thing in the event that I have a major medical claim, short-term medical then becomes the option. So short-term medical, prior to the Affordable Care Act, was designed to bridge a gap. I need something for 90 days, I started a new job, they don't give me coverage, or I am home for the summer from college, I need something. Short-term medical was designed to fill that gap. Well, that's no longer needed because we have special enrollment periods that allow you to pick up plans mid-year if there's a life event. So the insurers basically use short-term medical now as a way to skirt around ACA. So it doesn't have the 10 essentials, it doesn't have the guarantees that are built into the Affordable Care Act, which means it's much more like the wild, wild west. We've seen short-term medical plans that are as skinny as 3 doctor visits a year. Unfortunately, I had a client that came to us in 2013. She had, I think it was 70 or 71 kidney stones, but she only had a plan that covered 3 doctor visits a year, and she had to get surgery to have them removed. So that is not insurance. I tell people to stay away from that. Typically, what we're looking for in a short-term medical plan is something that will cover for 360 days of the year. Not 365, because then that would be a normal plan. It's the short term, 360. And December 26th of the following year, we would start over, and instead of it being a calendar year long, it's just 360 days. The problem with short term is that no pre-existing conditions, so you have to be healthy. It doesn't cover preventative care, so there's no free annual checkup, free mammogram, free colonoscopy. But the pricing is incredibly different. So I think we just enrolled someone that was 61 or 62. They were looking at $1,200 on the exchange for themselves, and the short-term medical plan was about $420. So an $800 a month difference to have a plan in place. Now that plan specifically is a PPO. It works with 500 PCPs local in Lancaster. It was a $5,000 deductible, I think, so she was comfortable with that much risk. $50 copays to see the family doctor and the specialist, and discounted rates on prescriptions. So not copay based, but definitely a substantial amount of savings. The other thing to answer your question is insurance isn't the end all be all. So if you're also looking to keep costs down, you don't need the dental plans and the vision plans, or you don't need as robust plans in place. There are systems out there. So like vision, sometimes I walk around with obnoxious yellow glasses. I don't know if you guys have seen those. I bought them as a practical joke for my 7-year-old for $7 on zennioptical.com, Zenni. Fully prescription. I have an astigmatism, completely corrected for it. They have better glasses, but if a $7 pair of glasses breaks, I'm not overly worried about it. Versus paying for vision insurance that's going to be about $15 to $20 a month, or $180 to $240 a year. So there are definitely ways where you can start to kind of cut expenses. I shared Able Pay on Slack a while back. So Able Pay is a partner that we recently started working with that instead of paying LGH every time you have a claim, you pay it through Able Pay, and Able Pay gives you about 13% off on your expenses. So their whole shtick is they've negotiated with LGH that they can collect your claims money faster than they would ordinarily do so. And then they pass the savings of the negotiated rate down to you guys. So they're passing 13%. They may be getting a 20% discount and keeping the difference. But ultimately, no cost to you, no cost to LGH, no cost to employers to offer that as a free benefit to their employees. So, Able Pay, yeah. I put it in Slack, but you should be able to search it in the top bar, and it'll come up. Any other questions? I can keep talking. I don't. Yeah, so we're currently in quagmire with that. Part of the reason is traditionally, if you're just talking to a regular broker, there is no cost because they get paid directly from the carrier. The problem is that in our case, we're looking at on-exchange, off-exchange, faith-based plans, short-term medical, Medicaid as options, and several of those programs don't pay us. So if we're a community-based organization helping with Medicaid enrollments, and we're putting in 10 plus man hours to try and get an application through, we're not getting paid by anyone because we're not grant-based. So traditionally, what we have done is we have a retainer. Because we're financial advisors, unlike a traditional insurance broker, that is their only modality. As a financial advisor, we very much operate like a CPA or an attorney in that capacity, where we are a fiduciary. We have to do what's in your best interest, and there is a retainer. So our retainer is $30 a month for an individual, $45 for a specialist, $30 for an individual, $45 for a couple, and $60 for a family. But it's really with the all-encompassing support of all the different elements that we're going to provide. You know, if there's a notification on a major regulatory change, you have someone you can lean into. If you have a claim issue, you have someone you can lean into. I say we're in quagmire because we're currently trying to reevaluate whether or not that's a good way to run our business, because a lot of the carriers are coming back and saying that they're going to pay. So if we can cut costs for our clients, we're trying to figure out the best way to do that. But that is our current mode, is that ultimately there's no cost to talk to us. If we find a solution that's better and you have the conviction to hire us to help you implement it, then you sign a contract saying that you're willing to pay that retainer. But Yo.
Since you were involved a lot with the hospital aspects, is there any tips or tricks to kind of use some smart talk to make them lower some stuff, like try to sneak something by you and kind of catch it or something?
So you have a medical claim that you don't want to pay for? Is that what you're saying? Just for clarity? Okay.
Yes.
So if you're an individual and you have a medical claim that you don't want to pay for and you make less than $48,000 a year and you have less than $10,000 in the bank, you can go right to that hospital and apply for financial assistance. They're there to help you with those. So like, let's say LGH, if you search LGH financial assistance through Google, they have an application you can submit. And basically what they're looking at is you're under 400% of the federal poverty limit. We are a nonprofit and we're trying to help as many people as we can. We will help take care of that claim. Any collections that you may have in process, they will pause those. Ultimately they do forgive certain claims if you're under that limit. So, but that's not a shady tactic. That is a resource that is available by the hospital systems. Or Able Pay, yeah. But you actually have to pay through Able Pay because they collect the claim payment from you. So, I think that's. Yeah, yeah.
As the state starts to take that over,
Uh-huh.
and you're saying you have set up a new account and all of that, will any information be passed over, or does that have to still be?
I am being told yes, that currently with Pennie, they are gathering the information from the exchange and pulling that over. What it's going to look like is anyone's guess at this point. They're still coding and figuring out the bugs on the back end, which we all know what the first year of healthcare.gov looked like if you were in that system. The benefit is that Pennie's on a chassis from Get Insured, which has been already doing this in Nevada and other states that have gone state-based. So I don't know, but the short answer is things should come over. It's just in what capacity. Yeah. All right. Well, I think that's, yeah. I give everyone 20 minutes back so I can eat pizza. But I did bring stuff down. There are pens here. There is, if people stop by throughout the day, they can see some of the stressors from an employee level and an employer level and how we are able to help with solving some problems. I have a 2020 tax guide, which is more from the hat of me being on the financial side. So it breaks down what your modified adjusted gross income, or actually just has your adjusted gross income for 2020 needs to be in order to, however you're filing, if you're single or joint or filing separate. I would definitely circle back to Dave. I wouldn't rely on a piece of paper for trying to figure out your taxes. Obviously, Dave Shiley and his team are going to be a better route for you. And then there's an information guide on just our process on the individual side, some of the other crazy things that we've seen, including a pastor and his wife that we worked with up in Halifax. They were paying $1,200 a month because they walked into a Highmark store, purchased their insurance, and walked out. And ultimately, he made $60,000 a year, but as a pastor, $20,000 of it is a housing allowance that's non-taxable. So he really only showed a taxable wage of $40,000. We were able to get him and his wife on a plan for $189 a month, and both kids actually got free chip. So our retainer at $60 a month, he said, I'd gladly pay $250 over the $1,250 I was paying Highmark. So it just gives kind of more stories on different ways that we've helped people on some of the stresses we try to alleviate. But yeah, that's it.
And one last question.
Yeah.
So if you miss the exchange time slot,
Yes.
You can still get insurance direct through an insurance provider, or no, you just have that time frame?
Just open enrollment. Short-term medical is a little different because that is not calendar year. That's, 360 days from the effective date. But major medical, you have to enroll during that time frame. It is the way that they avoid. So imagine being an insurance company and you have to take everyone regardless of their health history in order to avoid people enrolling the day after they find out they have cancer. They have that open enrollment period. Yeah. The way they used to do it prior to Affordable Care Act was you have to be medically underwritten, which is why we got rid of pre-existing conditions, was to say we will cover everyone, but you have to be diligent and enrolled during this time frame, which is part of the reason that right now CMS is still fighting with a lot of people, because there's been a lot of calls to do like a special enrollment period because of COVID. And the federal government has said, well, they should have enrolled back then. The reason that we have this time period is to not have people enroll when they actually are ready to go with a claim. We need to collect the monies throughout the year in order to cover those isolated events. So yeah, ultimately, at the end of the day, I think the big takeaway is that you want to make sure you understand who you're working with behind the scenes and their limitations and their benefits. Pennie's going to take over, and there are going to be about 400,000 people using it this year. So be mindful that if there's a slowdown, if there are issues, if your cards don't get to you as fast as you're used to them getting to you, it's because it's a new system with kinks. Now, you should at least be aware of that going into it, and hopefully our postal system is working by then, so we actually get cards in the mail. Who knows how that's going to be, but just kind of be aware of some of the challenges. We also, this year, we brought on a new individual, Linda, who is in the room with us as well. She has been a resource and a half behind the scenes. Basically, if you come to the 5th floor and you look at my little cubby hole that I have right now, there are a ton of Post-it notes and less every day, because there are a lot of concepts that I've basically funneled through here that need more time to absorb. That ultimately Linda has been taking those little nuggets, doing the research, and our hope is that over the next month and a half, 2 months, we're going to have an actual dedicated resource center on our website on these different concepts: how to make CHIP work, how to get, in addition to Able Pay, Zenny Optical and some of these other programs that we work with, how to make them user-friendly. If you are a business that's in its growth phase and you're trying to add employees, we'll have tips for HR. We'll have some pieces on, we partner with Bamboo HR and how HR professionals can improve organizational culture. So it's really going to be a very active website of a lot of good content to help people. So yeah, that's all I got.
Any kind of questions?
I just want to say something, Josh. Thank you very much.
Yeah.
Health insurance over the years has been very complicated.
Yeah.
With the ACA coming on and everything else.
Yeah.
Just strongly suggest, you can probably buy health insurance online, but I wouldn't suggest it. I would suggest going through somebody like Josh or Josh himself to get the holistic approach to health insurance. Over the long term will save you money.
Yeah, I appreciate that. It was funny, the lead financial advisor that I work with at my firm over on Fruitville Pike, he said, I'm not going to find something every year, but the thing that I find every 5 years is going to save you more money than the 5 years of having me as a resource. So I always kind of look at it that way. There are going to be problems that we all have that ultimately we may not have the answer, but we can take the 2-hour hold time with the insurance company off your plate, which to some people is worth more than than anything else because it's a nightmare. I mean, that's what Erica's actually doing right now. We have a couple of cases where the one of the cases we're working on right now to plug Austin is we had a CPA that started at a temp job, and they enrolled in the coverage through the temp job, but it was subpar, terrible insurance, and his daughter wound up in the hospital at LGH, and we're going through that financial assistance process right now. And we just found out 6 months later, even though they said we're working on it, that LGH's physicians actually bill under Lancaster Emergency Medicine. And that claim went to collections that they had no way of knowing. So Erica's the one that behind the scenes right now is trying to get all of these people in the same area, in the same room to get that claim picked up, because the daughter is like 22, 23. They don't have $10,000 to pay a claim. She's trying to figure out how to pay her cell phone bill and live life. So that's all packed in. We don't charge anything beyond that retainer. And hopefully, as more insurers add more competition to the county and to the state, we can get away from that altogether and just be a resource on any program that our clients need. So, all right, yeah, no problem.